The menopause is a natural journey women go through. It can present uniquely in every woman, and it can often be a confusing time as significant physical and psychological changes are experienced. Often these signs and symptoms are pushed aside or not addressed properly, resulting in women not receiving or looking for the right support to help them manage these better. The menopause is the phenomenon whereby a woman who has menstrual periods stops having them for at least 12 months as a result of changes in the levels of a range of reproductive hormones. Hormonal levels change over the course of a few years before the last menstruational period, but the key change linked to the symptoms of the menopause is the acute drop in levels of estrogen. During the transition, periods may become more irregular, and some of the symptoms characteristic of the menopause may surface. In some cases, this transition lasts for a long time. In others, it's abrupt. This is a part of the normal aging process and tends to happen between the ages of 45 to 55. The menopause can present itself in many different forms to different women. Some women experience severe symptoms that interfere with their daily lives, whilst others only have very mild manifestations. One thing that's important to understand is that the symptoms can be so strong that they may feel like a medical emergency. However, the symptoms of menopause in themselves are not dangerous. The most frequent symptoms are hot flushes and night sweats. Together they are called vasomotor symptoms. They are likely caused by the decreasing level of estrogen during the menopause and the effect on the temperature regulation system we have in our brains. Perhaps related to these two, many women report having difficulty sleeping. This can be quite a serious problem. There's a strong link between experiencing vasomotor symptoms and having problems sleeping. Low mood and anxiety are also relatively common during the menopause. Specifically, the risk of anxiety seems to be about 60% greater during the menopause, while the risk of depression goes up much more significantly, up to 2 to 4 times higher. Many women also report problems with memory and concentration during the menopause. This might be linked to the sleep and mood problems we have already discussed. Vaginal dryness and discomfort during intimacy is also an important symptom frequently experienced during the menopause. This one is the one that is perhaps best understood, as estrogen levels directly regulate normal vaginal secretions and help maintain the appropriate environment. This can lead to an increased risk of having water infections. Headaches and joint pain are also frequent during the menopause. Women report also having bouts of fast noticeable heartbeats called palpitations. These symptoms can start months or years before periods stop. They can also last around 3 to 4 years after the last period. Some women have them for a much longer period of time. Women experiencing these symptoms should not assume that they have to endure them. They can be extremely distressing and disruptive, and can affect other aspects of health. The sleep problems themselves increase the risk of various health conditions. If the symptoms are troubling, or these symptoms start before the age of 45, it's a good idea to consult with your GP. There are many available treatments, but the first choice is hormone replacement therapy, unless it's contraindicated. There are a number of effective non-hormonal treatments, including antidepressants. Weight loss and exercise have substantial health benefits like sleep and pain improvement, and are worth considering in addition to any other strategy or on their own. And certain forms of relaxation are quite effective, as is cognitive behavioral therapy. For example, applied relaxation reduces both the frequency and severity of vasomotor episodes. Mindfulness helps to control the severity of episodes, and visualization, called self-suggestion, in the app are helpful techniques to practice. Menopause is a journey that women shouldn't feel they have to go through alone. Supporting someone who's going through the menopause is a combination of the woman being able to express her needs and the people around her acknowledging them or responding to them with understanding. To offer support, you may want to validate their feelings, encourage open dialogue, and get a better understanding of the individual's needs, and ask them how you can support them. Give them time to open up. Speaking about menopause is a sensitive topic, so some women may never want to address it directly. Be sensitive to their individual differences.